Another life lost today, not because help wasn't available, but because no one knew how to respond. Hello everyone, my name is Tong from ES2 24005429. Today, I'll be sharing the DRSABCD Action Plan, a simple yet powerful guide to saving life in emergency. But before we dive into that, let's talk about something just as important, your first aid kit. A well-prepared first aid kit isn't just for cuts and blisters. It can help stop minor injuries from becoming major emergencies. A standard first aid kit is usually divided into 4 key categories. Firstly, we'll be looking into wound care and bandages. Adhesive bandages or plaster are used to cover small cuts and blisters to keep them clean and prevent infection. Sterile gauze pads help absorb bleeding and protect larger wounds, while non-adherent dressing are great for burns or healing injuries because they don't stick to the skin. Triangular bandages are incredibly versatile and can be used as arm slings or to wrap and support injured areas. Antiseptic wipes or solution are used to clean wounds and kill bacteria, while saline solution is ideal for gently rinsing out debris from wounds or eyes. Adhesive tape is used to secure dressing in place, and crepe or elastic bandages provide support and reduce swelling for sprains and strains. In addition to wound care items, a complete first aid kit includes several protective equipments. Disposable gloves, preferably nitrile or latex free, are vital for protecting both the first aider and the casualty from infection during treatment. A face mask adds another layer of safety, reducing the exposure to airborne contaminants. Next, we will be talking about tools and instruments. Scissors are used to cut bandages, tape, or clothing to assess injuries quickly, while tweezer helps remove splinters or debris from wounds to prevent infection. Safety pins are handy for securing bandages, especially triangular slings. A digital thermometer allows for accurate temperature checks, which can be important in identifying signs of infection or illness. Lastly, we'll be talking about burn, swelling, and shock supplies. Burn gel or burn dressings provide a quick relief for minor burns by cooling and protecting the affected area. Instant cold packs are useful for reducing pain and swelling from sprains, strains, or bites, especially when ice isn't available. Lastly, an emergency thermal blankets help retain body heat, which is crucial for treating shock or keeping a person warm in cold conditions. Together, these items ensure that first aid can be delivered safely, effectively, and with the right tools for a range of situations. And now, I will be explaining how to use DRS ABCD action plan. It is a simple checklist, but it can save life in those critical first few minutes. Whether you're at school, at work, or just walking down the street, you could be the first responder. D stands for danger. Before helping anyone, always check the area for danger. This includes danger to yourself, the casualty, and bystanders. Look around for any hazards, such as fire, live electricity, traffic, or chemicals. Your safety comes first. Never ever put yourself at risk. If it is safe, remove the danger, or, if necessary, move the casualty away from the source of danger. R is stand for respond. Check whether the person is conscious and responsive. Approach them safely and speak loudly while gently shaking their shoulders. Things like, "Can you hear me? Open your eyes. What's your name?" Or you can also use the count acronym. C, "Can you hear me?" O, "Open your eyes." W, "What's your name?" S, "Squeeze my hand." If they respond, keep them comfortable and monitor their condition. If they no respond, continue to the next step. S is for send for help. Call emergency services immediately. It depends on your country. For Malaysia, you may call 999. If others are around, delegate the task. You call the emergency services now. If you're alone, call as soon as you have checked for response. A stands for airway. You need to make sure the person's airway is open and clear. Gently tilt their head back and lift their chin to open the airway. Look inside their mouth for blockages, such as
food, vomit, or blood. If you see something blocking the airway, roll the person onto their side and clear it with your fingers carefully. Once the airway is clear, lay them on their back again and keep the airway open. B is for breathing. Now, check if the person is breathing normally. Use the look, listen, and feel method. Look at their chest for movement. Listen for breath sound. Feel for air on your cheek. Do this for up to 10 seconds. If the person is breathing normally, place them in the recovery position and continue to monitor them. But if they are not breathing or only gasping, prepare to start CPR. C is for CPR. If the person is unresponsive and not breathing, begin CPR immediately. The correct ratio is 30 chest compressions followed by 2 rescue breaths. Push down hard and fast in the center of the chest, about 5 centimeters deep, and at a rate of around 100 to 120 compressions per minute. After 30 compressions, give true breath. Tilt the head back, lift the chin, pinch the nose, and breathe into their mouth. Keep going with the 30 to 2 cycle until emergency helps arrive, the person starts breathing, or you can no longer continue. Finally, D is for defibrillation. If an AED, an automated external defibrillator, is available, use it as soon as possible. Turn it on and follow the voice prompt. Attach the pads to the person's bar chest, following the diagrams on the device. The AED will analyze the person's heart rhythm and will advise if a shock is needed. Stand clear while the shock is being delivered. If instructed to continue CPR, resume immediately. To summarize, the DRS ABCD action plan is a reliable tool that guides us through the most critical steps of first aid. By following each step, danger, response, send for help, airway, breathing, CPR, and defibrillation, you can help save a life while staying safe for yourself. Thank you, and remember, even basic knowledge of first aid can make a huge difference in an emergency. Thank you.